Hey everybody, welcome back to my channel. This is WGU_future_RN. And if you haven't already liked and subscribed on my channel, please like and subscribe below so that you can always get notifications of when I post. I'm trying to post a video a week. I know in the past I've been really bad at that, but so far so good. So you can also follow me on Instagram. I have the same name, but I'm going to link my Instagram down below. So today's video, I wanted to talk to y'all about how to pass your MedSurg Hesi exam. And even if you don't go to WGU, our school is really based around the Hesi, but this video is for you. Anybody who's taking a Hesi exam, this video can be for you. So I'm just going to talk and discuss about certain tips and tricks that I keep in the back of my mind to help, and just different test strategies that I use whenever I'm preparing for an Hesi exam. So let's get into it. So some of the things that I use, I'm going to show y'all in this video today that I use to pass the Hesi. And this is for the MedSurg, not fundamentals, but your MedSurg courses. So when you really get into those disease processes like cardio, respiratory, neuro, all of those, this video is about that class. And so for WGU, we have different names for those classes. So if you're in a regular program, it's going to be MedSurg 1 and 2. If you're in WGU, this video is for your casal2 and Caci classes. And so one of the things that I do to study for my Hesi is I bought this red book. I bought it actually from a student who had just finished the program. I think she sold it for like $20. You can also buy them on Amazon and maybe even on Marketplace, but definitely reach out to some of the students who have previously graduated the program, because then you can get these books for pretty cheap from them. This book is essential when studying for the Hesi. Obviously, Hesi makes it, and so it's going to have a lot of Hesi details that you need. One thing I really like about this book is the Hesi Hints, and I'm going to turn to the MedSurg. So green will be your MedSurg unit in this book. And I'm going to show you kind of like a Hesi hint of what they have. All right, so say we go to aortic aneurysm, okay? So you have this yellow box right here. It's a Hesi hint. And it'll say things like, Hesi hint, a client is admitted with severe chest pain and states that he feels a terrible tearing sensation in his chest. He is diagnosed with a dissecting aortic aneurysm. What assessments should the nurse obtain first? For the first few hours, okay? That's a good Hesi hint because it's possible that you might get a question that's similar to that on the test. And so it goes in order and tells you like what things, what outcomes you're going to want to do, what assessments and interventions you're going to want to do for a person who is having a dissecting aortic aneurysm. You know, vital signs every hour, neurologic vital signs, respiratory status, urinary output, peripheral pulses. These Hesi hints have helped me a lot through all of my exams. Also, Hesi has questions in the back of every chapter. Let me see if I can show y'all. They'll have these little review this body system, and they'll have questions that you can answer. These are very helpful too. Also, in a class like MedSurg, the key to understanding how Hesi practice questions work and how the tests work is practice questions, practice questions, practice questions. I can't stress this enough. There are two ways to do this. You can go to Your Best Grade and get a subscription. I think it's like maybe $100 a year for the year or something like that. I can't remember. I'll have to go look at that for y'all. Also, there's a separate like test bank that you can buy for this, or you can purchase a book that comes with the test bank, and it gives you access to thousands. And the good thing, if you're a WGU student, so that's for if you're not a WGU student, but if you are a WGU student, you get free access to this Hesi book online and also their test bank. So I ordered this in in physical book form because I'm not very good at just constantly reading things online. You know, it makes my head hurt, it makes my eyes hurt after a while. I like to highlight and write notes, things like that. But if you're a person who can read online and be fine, that is a great way to save money because you have access to this book, and we also have access to that test bank. Also, in your Unit 1 of your class, you have something called adaptive quizzing, and that gives you also an unlimited amount of access to thousands of practice questions. So if you're not utilizing these resources, and you go to WGU, I really recommend that you utilize those resources. So let me show you. I'm going to go on here and show you how to get to your adaptive quizzing, your Hesi book, and your Hesi question bank.
If you are a WGU student, you're going to log in. So this is what the mobile app looks like, but you're going to log into your WGU account, and you're going to go to your courses. These are all my courses, and click on a course. And it's the same for every course. So you're going to go do the same thing for casal2 as I'm doing for peds right now. I'm going to go down, go to course material. Sorry for my slow Wi-Fi. You're going to have a table of contents pop up. You're going to go to your Unit 1 and scroll down and keep going. I want to say it's on the second page. Oh, it might be right here. No. Okay, so it's on the second page. You're going to go to the page that says Resource Fundamentals, Hesi Comprehensive Review, Questions, and Quizzing. You're going to go down here to where it says you can access the Hesi Comprehensive Review right here, access practice questions here, and adaptive quizzing here. And this is really cool because you can click on it and get access to thousands of questions if you're a WGU student.
If you're not a WGU student, that's okay. You can still purchase a subscription with your best grade and have access to thousands of Hesi type questions. I approve your best grade, and this isn't promoted or anything, but I really love your best grade. I have talked to so many students that are in this program. We all love it. It really helps you dissect Hesi questions and kind of get the feel of a Hesi type question before you actually go into the exam. They're actually really close to how Hesi asks their questions during an exam. So also, the next thing I do, and I'm going to show you guys this, is I make concept maps. And if you're not familiar with what a concept map is, I'm about to show you. And you can make your own. You can download a template on Google. You can buy one. You can ask your instructor for one. And anything that's going to help get this vast amount of information in one place is going to help you. You can even draw it out just with your hands. You don't have to. But I made my own concept map, and this is kind of what it looks like. You have your pathology, your disease, patient education, assessment, diagnostic tests, nursing considerations, treatments, signs and symptoms. This is a must when you're studying for any Hesi test or ATI test. So most of these tests want you to know the pathology behind the disease, the tests you do, the assessments you do, patient education, treatments and medications. So this kind of just takes a huge chapter of information and condenses it to this one page that you can really, really study and get it just drilled into your mind. For example, this one is Addison's disease, and so Addison's disease is the secretion of not enough ACTH hormone, and it just means the adrenal glands are not working properly. I did some patient education, like they're going to need to take oral hormone replacement. They're going to want to wear a Med Alert bracelet. You want to assess for low BP, dehydration, glucose in the blood, low glucose levels. You know, some certain tests, you're going to want to do blood work on them. You're going to want to get an MRI, just things like that. So when you're really studying these diseases, the information is a lot. And sometimes it's too much to take in. So concept maps just condense that information. And if you want to know more about how to make concept maps, how to choose the most important information and place it, and make sure that you're getting that full amount of knowledge, I'll be making a video on how to make concept maps. But since this video is just talking about how to pass a Hesi exam, I didn't want to flood it with too much information. So I will have a separate video on making concept maps with me and choosing those most important things. So I have a casal2 and Caci binder. I printed off some medication endings. I printed off like a study guide for calculations. Let me see, what else? Easy med dose calculation, practice. I like to print out a lot of different things to help me. I find a lot of this stuff on Pinterest. And this is an outline that my instructor gave me. Some instructors are different. Some give out study guides and outlines, some don't. And this was just kind of something to go by. So that's how I organize that. And I also organize my concept maps in the back here. I do red for I do purple for neuro, and then blue for respiratory. So that just kind of keeps me, green I think for endocrine. So that just kind of keeps me organized and to know what's next. All right, what else? I use Quizlets. I use Quizlets all the time. I made a Quizlet. So if you're in casal2 or higher, all you have to do is type in Quizlet, WGU, casal2, and then type in the chapter name or chapter 24, chapter 30, and my Quizlet will pop up, and it is everything you need to know is in that Quizlet. And normally what I'll do is I'll print those Quizlets out and put them in a binder and just kind of have those to go over with my concept maps. Something else that I use, and y'all know, I know y'all hear me talk about this a lot, and I will continue to talk about it. Kathy Park's flashcards, yay! I love her flashcards, and they're just great. They take a lot of information and condense it. So, you know, you have this medication right here, and it tells you all the side effects, the actions, all of that. Let's see, we have a disease. All right, say you have ulcerative colitis, okay? It tells you your labs, your risk factors, meds, and nursing care, and it's all condensed on the back. Now, I know some things happened with Kathy Parks. I swear by these. I was on a 3rd attempt for an exam. It was the last attempt I had left, and these saved me. It just helps put a lot of information into a small little card condensed down where you can flip through it every day and just memorize everything you need for the test. I'm not sure if she sells these anymore, but you can watch her videos on YouTube and make type them up in Quizlet, and you can flip through them on the flashcard mode on your phone. That's what I would do. And so I wanted to give y'all some tips on how to break down Hesi type questions. So when you're in the test, you never want to choose an ask why question. Never, ever, ever. You want to try to choose the best therapeutic communication you can. So never demeaning the patient, never, you know, forcing them to do something or you have to do this, right? And then never ask why. If you've never heard of the answer choice, please don't pick it. Just don't pick it. If it's not in your brain, then you didn't learn about it. It's not the right answer. If there are 2 or 3 answer choices that are the same, 9 times out of 10, none of them are going to be correct. If 2 choices are opposite, one of them is always going to be the correct answer. You have an order for everything. So when you're on the test question and you're thinking to yourself, oh my gosh, can I give that person a catheter? Do I need to call the doctor first? Just know in the back of your mind on the NCLEX or on a Hesi exam, you always have the order for it. And always, always, always make sure that you've done everything you can to the patient before you call the doctor. Remember ABCs, airway, breathing, and circulation. So obviously you want to make sure their airway's clear. Say they have a neuro disorder and you're thinking, oh my gosh, I need to do all these neuro checks. I need to assess this and that. Well, you know, when they have a neuro condition, you're going to want to check their airway, right? Because the sensors in their brain aren't working, and it might tell them to quit breathing. It might, you know, start closing their airway. We don't know. So you always want to make sure their airways are open, and that even like a stroke patient, when they're going to eat, check those swallowing and choking hazards, all of that. And a lot of people don't know this, but blood pressure falls under circulation. So say you have all these vital signs you're supposed to be checking, and blood pressure is one of them. ABC, so circulation, you want to check the blood pressure. That could mean something serious is going on. If it's high, if it's low, they could be going into shock. So that's important too. And then next, you would always want to assess temperature, because then that could be a sign of infection or something going on there. You want to look for repeated words. So in the test question, if you see a word that's repeated in the answer choice, most of the time that's probably going to be the right answer choice. So if all the answers are correct, then you want to try to choose the answer choice that has all of them together in it. And I know that sounds so weird, but there's going to be an answer choice that kind of, some way, somehow, even with weird wording, will have all of those same answer choices in it. You want to always assess unless in distress. Remember that. Always assess unless in distress. So if your patient is over here having shortness of breath and chest pain, well, of course you're going to want to, you know, give them nitroglycerin. You're going to want to give them oxygen. You're going to pull up the head of the bed, stuff like that. But if they're not in distress and they seem fine, even though they came in with chest pain and shortness of breath, you still want to assess all their main vitals first. Always do least invasive first. You're going to want to elevate the head of the bed right before we do oxygen or anything. Elevating the head of the bed is going to put them in the correct position to open up and expand those lungs, so that when that oxygen's going in there, they're getting the full activity, right? And who knows, if you elevate the head of the bed, they might start breathing properly, and they might not even need any oxygen. So always do least invasive first. So these were some of my notes of how I passed the Hesi exams. The day before the test, the night before the test, I've started going to bed early. I wake up in the morning, do some cleaning, go through some of my flashcards, and right before the test, I take a Spark and I eat a piece of chocolate. I get my whiteboard and I write everything, like when the test starts, I write everything on it that my brain can remember at that moment, so that during the test I can look at it. I write all these things down on my whiteboard, and I take my time. I try to do deep breaths when I feel like I'm getting anxiety. And I also dissect the question. I write down what I'm looking for. Is it an assessment or an intervention or a priority? What is the question asking me? What's the patho behind this? And then I write down all the answer choices, and I narrow it down. I write notes, and I try to pick the best one that I can. I take my time. You do have 2 hours for this test, however WGU allows you 4. But with all of these things, putting all these things together and studying for a good 1 to 2 weeks, you should be definitely ready and feel confident enough to pass your Hesi exam. So I hope that this information was very beneficial to you, and I have more videos to come. I plan to do a video, like I said earlier, about the concept maps. I plan to do some videos going over topics in MedSurg, so respiratory, cardio, things like that. So if y'all have any questions about anything in this class, please leave it in the comment section below so I can know to answer them and address them in my next video. I'll also be showing y'all how to organize your notes in an online school, and how to make flashcards, things like that. So I really hope that you got a lot from this video, and if you like my content and you want to see more, just remember to like and subscribe. Thank you. Bye.